Hello, my name is Stefano Luminari. I'm Associate Professor of Medical Oncology at the University of Modena and Reggio Emilia in Italy. Follicular lymphoma is an indolent lymphoma that is characterized by a very long natural history, with the exception of a smaller group of patients that is estimated around 20% that show more aggressive clinical features with a higher risk of dying from the disease. And today we are able to identify this patient using a very simple criteria, that is to look at the duration of response to first-line therapy with the concept of POD24. Patients with shorter duration of response show a higher risk of dying from the disease. We have several available options to initially treat our patient, and the decision is mostly based on the simple assessment of clinical stage and the tumor burden of the disease. These concepts are very simple. However, with time, we have developed more complex assessment of prognostic features of our patients that are based on the clinical evaluation of the patient at time of diagnosis, that are based on the integration of genetic features, including gene mutation profile or gene expression profile, and more recently with the definition and the assessment of the quality of the response. Among these features, however, the baseline features are not accurate enough, as well as the biological prognostication is not accurate because it has been shown not to be stable enough under the condition of different treatment options. And only the metabolic response, and so the concept of the quality of response, has been confirmed to be very stable and very informative in the different treatment scenarios. The concept of metabolic response that is complete when defined using the Deauville criteria and with scores of Deauville 1 to 3, has been shown to be associated with the good prediction of the duration of response and also in the risk of dying from disease. But unfortunately, most of the patients, so I would say unfortunately, most of the patients respond very well to the treatment, so the prognostic information that is achieved with assessment of the quality of response is important, is relevant, but is only obtained and useful in 1 out of 10 patients approximately, because the response rate to initial immunochemotherapy is in the region of 90%. So just to conclude very simply, trying to answer the question of that was initially addressed in this discussion, unfortunately, we do not have any useful prognostic tool that support our initial treatment decision in follicular lymphoma patient. And then for the time being, the best approach would still be that is recommended by available guidelines, that requires a very simple assessment of clinical stage and tumor burden. In the future, for sure, we will be able to show and to validate more accurate prognostic and predictive tools that will be based on better biological profiling of our patient and better assessment of clinical prognostic indexes at the diagnosis. Thank you very much.